Is there anything specific an individual doctor can do to make sure his or her practice survives post-COVID?
Well, there's a lot, and that's part of the business that we do too. I mean, my goodness, we, in a period of a week or so, we got everybody up on telehealth capabilities. Nearly 1,000 primary care providers across the state of Texas. We helped them all, not all, but a vast majority of them get PPP loans. We created a 120-day financial plan for all these practices, big and small, to better understand what their financing needs might be and choices they had around if revenue is going to drop because of fee for service and people aren't coming in. How do they manage expenses? How do they manage their own take home pay, which many of them have suspended? How do they furlough? How do they help with making sure if they did get a PPP loan that they actually can service that appropriately? How do we get educated on testing? How do they get educated on going back into the office and providing a safe environment that patients and their employees will want to come back into? This is an unprecedented time that actually we've done a ton in just the last 60 to 90 days. I mean, think about what all that entails. That's been weeks, that you could argue to takes years. So it's a multifactorial thing right now. And so, physicians very much are having to readjust, just like we are at home, potentially our budgets, right? You're having to make choices about things, and what they're going to be able to. The ones that are going to be able to make it through are the ones that got good counsel, people that work with us, like at Catalyst Health Network, to make sure that they're part of a system that can support them not only on the clinical side, but on the financial and the business side and the overarching strategy to help them get through. As of right now, we've had no practices close. Of all of those that I mentioned, we have a waiting list of over 500 physicians across the state of Texas that actually want to join because they understand that need that they're going to have clinically from a team-based standpoint and technology, as well as the business side of helping to have a little more acumen around how to run the business. COVID has just pulled out, opened up a chasm, and they're realizing that they need a bridge to help get them to the other side. We're there doing that for them. It's hard to do on your own. It's really hard to do on your own. That whole thing of we're in this together. You really do need to find allies, especially the smaller the practice and the more rural you're in, to how you make it from the other side. So there's no one thing. There's no silver bullet. It's a whole. It's a metamorphosis, really, of the future of care and care delivery, which is why we've spent the last 100 days advocating aggressively across all payers for this prospective payment, because that is the one thing that would make a massive difference to the health and well-being of these practices. And if you don't have the health and well-being of the practices, you don't have health and well-being of physicians. And if you don't have health and well-being of physicians, you're not going to have health and well-being of patients, which is our communities in whole.